Started. Welcome everyone to our COVID-19 panel discussion addressing your questions about COVID-19 testing, vaccines, and equity. I am your host for the evening, Alex Kimball-Williams. I use she, her, or they, them pronouns, and I'm from Lawrence. I'm like a lot of you. I'm also the health equity planner at Lawrence Douglas County Public Health. I've had the honor of working alongside many of the talented individuals who are part of the planning and the panel for tonight that we have selected for tonight's panel. I work as an equity impact advisor as part of the Douglas County Unified Command, and I'm also a member of the vaccination planning team, helping ensure that equity is a part of that conversation. So before we get to the next things on our agenda tonight, I also wanted to extend some very special thank yous to people that made this event happen tonight. First of all, I would love to thank the Unified Command leadership for their logistical and promotional support. I'd also like to thank the event planning team, including Rua Hasabala, Carrie Britt, Elizabeth Stevens, Porter Arneal, Greg, George Stiepenbrock, and more. Also to the vaccination unit, surveillance testing unit, equity impact advisors, and the PIOs involved with the content tonight. I also want to thank our lovely panelists for making time tonight. A lot of them are putting in overtime to be here tonight and help answer people's questions. We have a lot of moving pieces going on, and so I thank you for your time. I also would like to thank my co-moderators for the night. We have Porter Arneal from the City of Lawrence helping us with some video and other tech needs. He is managing our weight room. So huge thank you to Porter. That is a big responsibility. I also want to thank Elizabeth Stevens and Carrie Britt because they're helping to moderate our chat, which is going to be very important later tonight when we start opening it up for Q&A. But without further ado, I will forward it over to Porter, who's got some housekeeping messages.
Thank you, Alex. Good evening, everyone, and thank you for joining us tonight. As Alex said, my name is Porter Arneal, and I'll be facilitating the Zoom video portion of the meeting tonight. And bear with me because I'm also simultaneously letting people in. I just want everybody to know that this meeting is being recorded and broadcast on the city's YouTube channel and cable access channel 25. The recorded meeting will be available on the city's YouTube channel. You can search for City of Lawrence in YouTube to find it if you don't have the link. And the link was published on the document. And hang on, I've got to mute somebody here. There we go. I just want everybody to know that over 300 people registered for tonight's meeting. So this is a very large Zoom meeting. So we really aren't going to be able to let people speak. So what we have so far is questions that have been submitted, and Alex has a list of those questions, and she's going to start the panel moderation with those questions. I'm asking everybody to please listen carefully to the panel members' answers, and if you have additional questions after that, please send them to me through the chat function, and then we will send them to Alex so that she can ask those questions in an orderly way during this meeting time, because if we allow people to try to speak, it'll just get too confusing, I believe. So please keep your mute on and use the chat function to submit questions to me. The panel will do their best to answer as many questions tonight as possible. And we also will have all these questions so that more information will be made available in the near future if we don't get to every question tonight. And if you have any Zoom-related questions or anything, you can also send me a direct chat that way. Bear with me a second here. So everybody knows how to use the mute option. Just down on the lower left-hand corner typically is a microphone icon. If you click on that, you will mute yourself. I am going to be generous in muting people as I need to, just so we minimize and eliminate background noise so that everybody can hear the meeting. For the panelists, we're asking that they state their name for those who may be joining the meeting remotely. So we'll have the panelists do that so you know who's speaking. Regarding your video, you can turn your video camera on or off by clicking the video icon in the menu. For the purposes of this meeting, when you're participating in the meeting, please keep your video on. But when you're not participating, it is absolutely okay to turn your video off and just listen to the meeting. So don't feel like you have to leave your video on necessarily. You can turn your video off and still hear the meeting. If you're participating by phone, you can click *6 to unmute your phone or to mute your phone. And most of us all probably know this. For those using Zoom, somewhere on your screen, you will see a choice to toggle between speaker and gallery view. Speaker view shows the active speaker, while gallery view tiles all of the meeting participants at the same time. And now I'll turn the meeting back over to Alex.
Thanks, Porter, for those helpful housekeeping messages. Definitely reach out to him if you're struggling. We want to make sure that with this large number of participants that everybody can hear what's happening, and especially because these questions are very important. Thanks to everybody who's present, all of our community members for coming to share your questions and your concerns with us. We definitely appreciate that trust, and we appreciate that you're trying to be informed through credible means by coming to this panel and listening to Unified Command Leadership. But speaking of Unified Command Leadership, we do have Robert Bienecke on the call, and I thought this would be a great opportunity to kind of introduce what the Unified Command is to people who may not fully understand what that leadership structure is. So Robert, take it away.
Hey, thank you, Alex and Porter. I'm Robert Bienecke, the Director of Emergency Management for Douglas County, and I wanted to just give you a brief introduction. I know a lot of you on the call know what a Unified Command is, and but for those of you that don't, I'm going to share my screen so you can get a visual of the structure itself. Is that up there? Alex, can you see it?
Yes, it is.
Okay, perfect. So just so everybody knows, we didn't make up this term. This term has been around for a long time. It falls under the Incident Command System, which has been around since the 70s and was later incorporated into the NIM system in 2004 by Homeland Security. So this type of system, this organizational chart that we're using, it's used all over the country and world for disasters. It's used for hurricanes. It's used for wildlife fire. It works. And it works because it brings the players to the table that need to be here, multiple agencies inside and outside of government. So we come together and we can coordinate and organize a response efficiently and effectively. So it also allows us to have a common language of organized documentation. So everything that we have done since we stood up on Unified Command in March has been documented. Every meeting and every UC meeting is documented, and we create a plan every week. It's called an Incident Action Plan, and we have that as a guide for us to work through each week. So if you look at the top of that chart where it says Unified Command, you'll see the representation from the county government, Sarah Polinsky, city government, Craig Owens, Russ Johnson, who's director at the hospital, Dan Parcher is the director at public health, Bonnie Lowe is the director at Chamber of Commerce. Oh, lost it for a second. Anthony Lewis is the superintendent of USD 497, which is Lawrence School District, and Doug Gerard is the leads up KU for us. So we felt that these entities needed to be at the table, and it's been really a good working relationship. You know, one thing that we've a takeaway from this is that we're working with people. A lot of us are working with people we've never met before, and you know we're coming together and creating new relationships. So. And if you look just going down the chart, you can see some boxes in there. You know, we have a public information box, a safety, equity, and liaison. And, you know, the equity box you see there, you'll see 3 names in there. Those are the leaders of a team that we've incorporated into our work. So this team of equity advisors, they are blended in with every box you see on here. They attend these meetings and they give us advice, and they really kind of help us and steer us in the direction we need to stay equitable in our decision making and policy making as we move forward. So, so our current priorities as we work through this pandemic is maintaining hospital bed space. That's key priority to keep the COVID bed space open. Vaccination planning and administration, both of those at the same time. The current vaccinations that are going on, and planning for future vaccinations as we continue into these phases. And then, community well-being is that third objective that we really feel is important. You'll see on that chart that there's a community well-being branch, one of the newer branches, but we realize that mental health in the community, people have been shut in for a long time. Kids have been staying home. Recreational activities have been limited. all those things affect people. And so we're really in a concerted effort to help with that. And so that's been a very, very important branch in what we do. So I don't know that I need to get much deeper than that. And I guess I would entertain questions whenever question time comes around. That's all right. Back to you.
Thanks, Robert, for coming through to share about the unified command structure, because I know for me personally, I get names mixed up and acronyms mixed up, and I just kind of want to know who are the people in charge with names that I recognize. And so thanks for explaining that. I think for a lot of the community members that are tuned in tonight, just to repeat and reiterate Robert's point about who's involved in the unified command leadership. We have Douglas County, City of Lawrence, Lawrence Douglas County Public Health, LMH Health, the Chamber of Lawrence, University of Kansas, and Lawrence Public Schools. And there's probably a few stragglers in there that are part of branches that don't belong to one of those entities, but they're helping us nonetheless. So thank you so much, Robert, for giving a brief introduction about that to our audience. So I'm sharing my screen now. This is a general agenda for the night. As you can see, we've gotten through the first couple of points of it. We did some welcoming announcements, introduction to Unified Command. But I wanted to take this moment, it was Porter's idea, thank you, for sharing a couple of resources that I think folks on this call would love to know about and love to stay tuned to stay updated on information. Very first and foremost, we do have a COVID-19 response and recovery hub. This has daily updated information regarding local stats. I'll just kind of scroll through it a little bit. It has directions about what phase that we're currently in and who is under that phase, ways you can find out more information. This is some information from KDHE, Kansas Department of Health and Environment. There's some interviews that you can watch here about the COVID-19 vaccine, and then of course about the panel that we're all on right now. Information about how you can get tested, and some of these other resources. And I'm not going to go through all of the agency-specific information, but I did open up a few of those. This is the one from the City of Lawrence, and it also links you to the hub that I just showed you. It has some information here for you if you'd like to go to their page. What I appreciate about the city's page is that they do keep track of all of the media and article information that you can read if you'd like to see things in a date-stamped kind of way to kind of see how things have progressed. This is LMH Health's page for information. They do have a coronavirus hotline that you can call. For a number for scheduling questions, you can call 785-505-2424. And I'll repeat that. That was a number that was given to me shortly before this call. The number for calling LMH regarding scheduling questions is 785-505-2424. So thank you, Brian, for providing that information for us before this meeting. We also have the Senior Resource Center. So if you need help because you don't have access or constant access anyway to internet or to devices, or if you struggle to use devices, iPads, smartphones, all of that stuff to get yourself scheduled or to sign up for the vaccine interest form, definitely call the Senior Resource Center. Their number is at the top here. So in case you can't see it, because that might be really small font, it is 785-842-0543. And I'll repeat that. It's 785-842-0543. And so that's to the Senior Resource Center, and they have graciously volunteered. Megan Poindexter has been our point person in that effort. They have graciously volunteered to help people navigate to get registered. And then last but not least, we have the Health Department page, and there's lots of helpful information here and graphics about COVID-19 and what our local response efforts are. Some information, and then links to additional information from CDC. Awesome. So without further ado, I'd love to start introducing our panelists. Thanks for hanging in there with us as we did a couple of introductions and other messages. I do plan on going back over some of these resources at the end of the call in case we had people that weren't logged in yet. So those information will be shared again. But let's move on to our panelists. So first up, unfortunately, Sonia Jordan will not be with us tonight. She was needed elsewhere. So very sorry for that, but we do have Sarah Plinsky filling in for her. She's part of the senior leadership for the Unified Command. So that ended up being a great trade-off. Second panelist is we have Jennifer Scrimshire. She's an MD, MPH, works at LMH Health in infectious diseases. She's our sitting physician for tonight. We also have Rua Hasabala, MPH. She's part of the COVID testing equity efforts here at the health department. And then we have Tiffany Lewis, RN, BSN. She's the Chief Operations Officer at Heartland Community Health Center. And then we have Brian Bradfield, Associate Vice President and Ancillary Services at LMH Health. So I'm going to stop share for a second. I'm going to go down the line and have each of you wave so people can see you in real time here on the video as well. So Sarah Plinsky, will you wave first? There she is. Thank you so much, Sarah, for jumping in at the last minute here tonight with us. That is so nice of you. Next up, let's see, Dr. Scrimshire. I see you there. So go ahead and wave for the people. Yep, so there's our sitting physician. Tiffany Lewis. Thank you so much, Tiffany. She's our person from Heartland, and she's also part of the vaccination unit planning team with me. Next up, we got Rua Hasabala. Thank you. She works at the health department with me. And then we have Brian Bradfield, last but not least. So yeah, he's on the vaccination planning unit and works at LMH Health. So thank you to my panelists for joining us tonight, and very sorry that Sonia can't join us tonight. So yeah, let's go ahead and get into our questions. Sorry, you'll hear my papers shuffling. I'm old school with the papers. So the first question for tonight is, how can individuals experiencing accessibility or other barriers find out when vaccines are available and sign up? And by barriers, I mean access to the internet, technology, transportation, English language, mobility, ease of use with devices, and more. So I'm going to pop that over to Brian first.
So it's a really broad question. From an accessibility standpoint, we're definitely working on different constituents throughout the community to get contact information, ability to reach those that we may not be accessing via electronic media. I know at LMH Health right now, we're offering both electronic and online scheduling as well as a phone line service. We've got Erica Hill in our organization also helping us identify equitable ways for people to enter into the vaccination programs from different avenues. We're also utilizing some resources that we identified during our surveillance testing and working with RUA to identify what those groups are and how can we continue to change and address those issues. We may not have all the answers now, but we're definitely learning as we go and taking feedback as we go and introducing new ways to get access and break down those barriers. Really focusing on looking through a lens of equity and doing everything we can in the moment to address them as they pop up.
Thank you, Brian. Does anybody else from our panel have anything to add? Alrighty, well, let's move on to, we have a lot of questions tonight. Next question, I'm going to pose it to Tiffany. Which organizations are involved with vaccine distribution planning?
Hey, everyone. So right now there are 3 organizations in the county, actually 4, because I don't want to leave Haskell out. So we have Haskell, we have LMH, we have the health department, and we have Heartland Community Health Center, and we're all on the vaccination planning committee to try to bring this together with Unified Command.
Thank you, Tiffany. Brian, do you have anything to add?
Well, I think the only thing I would add is that with the low level or low volume of vaccinations that are coming in from the distribution of the state, the need to have multiple distribution sites isn't as important. So keeping it focused and centralized around 4 organizations allows us to leverage those doses. They also have some storage requirements. If you receive the Pfizer, you need the negative 70 degrees freezer. And if you receive the Moderna, you just have to keep them in frozen capacity. So there are some restrictions on how those doses can be delivered. LMH Health right now is a designated delivery site for the frozen Pfizer doses. We were fortunate enough to receive a donated sub-temperature freezer from Donna Johnson. It keeps the freezer to negative 80 degrees. So right now the Pfizer doses are coming to LMH and then redistributing those out to the 4 entities as needed. As we start to see an increase in the distribution, you'll start to see an increase in the number of organizations that will be distributing the vaccinations. As of yesterday, there were 50 organizations on the vaccination distribution list that have registered. So as more doses come out, we'll be accessing more facilities and seeing that distribution rise.
Thanks, Tiffany and Brian. Anybody else from the panel have anything to add? All righty, moving right along. So this is also a Tiffany and Brian question. So where can people receive the vaccine? Is it based on where they live or work, or either? And can someone receive their doses from different providers?
Brian, do you want to start or you want me to start?
Oh, go ahead.
So again, broad question. Heartland right now is responsible for healthcare providers and law enforcement officers. I think LMH is responsible for 65 and older. Heartland has today, we're going to try to help in some other areas. We're still working out the logistics of that. We recommend that wherever you received your first dose is where you receive your second dose, because second doses aren't always guaranteed unless you receive the first dose somewhere else. But we are compiling a list in case people decide they don't want to get their second dose. So each entity has a list, and we're going to put those lists together in the best way possible to make sure that we communicate amongst organizations to make sure that the community is vaccinated. But we don't want to make any promises just in case our vaccine distribution gets any lower. And right now, I think LMH is doing vaccine and the health department will be doing vaccine tomorrow. Brian, I'm not sure if I missed anything, so you may want to piggyback.
No, I think with the currently right now, just like Tiffany said, we have 4 organizations giving out vaccinations. Haskell is definitely focused on the different subgroup than the other 3 organizations. And so they're more kind of in a lane with the Indian nations. Definitely what Tiffany said, we're receiving our first dose, which the state is calling the prime dose, and then we're receiving our second dose, which the state is considering the booster dose. And all those distributions are based on the location where you receive them. So if, for example, Heartland in their first round gave 1,000 prime doses, then they're attributed another 1,000 booster doses. If people start moving into different distribution locations, then it throws off the vaccination counts. And once you open a vial, that vial is set for a 4 or 5 hour expiration. So it's really important to keep the numbers consistent at each location so we can minimize waste and make sure we coordinate and vaccinate the prime and the booster dose appropriate to the schedule. For Pfizer, you get your first dose, 21 days later, you get your booster dose. And for Moderna, you get your prime dose, and then 28 days later, you get your booster dose. And each of the organizations are working their schedules on that 21-day and 28-day schedule. So it's really important you focus on going to the same location to get both doses.
Sarah, I see you unmuted yourself. Do you have some input?
Yeah, I thought it might be, I think part of that question was, what if an individual lives in Douglas County, but perhaps works in Johnson County as a teacher? And so they'll be coming in phase 2, and how do they access vaccine? And I think Brian and Tiffany can correct me if I'm wrong here. You can receive vaccine in either location. So you either where you work or where you live, whatever works best for your availability to get that vaccine. So we have done that through phase 1, where we had healthcare workers that lived here but worked elsewhere, and they received vaccination through us, or they may have received vaccination in another county. So that is not a barrier.
Yes, true statement, Sarah. You can receive it whether you work and or where you live.
Thanks for clarifying that, Sarah. That was, I think, a few questions that we had received, and I kind of consolidated them all into the one question. So thanks for the clarification. What is the easiest way to sign up for the vaccine? I'll bounce it to Brian.
So right now we have different groups focusing on different subgroups within phase 2. Phase 1 is continually being done for both dose 1 and dose 2 for the remainder of the healthcare workers and critical to the response team at LMH Health. And those are being coordinated through a specialized call system. So we're receiving names in from a registry that actually closed yesterday. And that list is being utilized every day. And we're calling those folks to get scheduled into the LMH Health facility. Outside of that, if you want to get an opt-in, it's best to go to the health department's website and complete the online opt-in form. Within that form, you will self-attest which group you fall into, and each of those people responsible for those groups will then contact you. For example, LMH Health is doing 65 and older, so if you're 65 and older, when we get doses in for that group, those folks will be contacted that your turn is up, and we will work on getting you scheduled. For other groups that are going to be going to the county for vaccination, as an example, USD 497, those people have assigned leaders within the vaccination team, and those leaders are working with their individual organizations to make sure that they have a list of people that qualify within that subgroup. If you do not have a leader or an organization that is represented within that vaccination team, you should go online to the county's website and do the opt-in so you get identified and put on the list. So when your turn comes up or that phase comes up, you can be identified as someone that is interested in vaccination.
I would just add in summary, Alex, that the vaccine interest form or the opt-in form is the same form, whether it's on the health department or the county's website, or you see another link. All of that information is compiled together into one database. So I know sometimes we say, the county website or the health department website, it's all the same form, it's all the same information. And we do encourage that if you're over 65, that you use that online vaccine interest form to indicate your interest in being receiving the vaccine. And the rest of the groups will have more specific information as those plans are rolled out. I don't mean to completely restate everything you said, Brian, but I thought I just want to clarify that it doesn't matter. This is the same form and the same process regardless of what website you access it from.
Thank you so much, Sarah. Tiffany, did you have anything to add?
I think we should just also let everyone know that the Senior Resource Center, for those that don't have internet access, displaying that number again where they can call the Senior Resource Center at 785-842-0543, just for those individuals that do not have internet access or the capability of filling out the online form.
Thank you, Tiffany, because that's going to be a big struggle, I think, for people who, they need to sign up, but they may not be able to do so themselves, or they may have difficulty navigating web pages. And so thanks for elevating that again. And we'll definitely elevate that number, the Senior Resource Center, again at the end of this call for folks who did not hear it at the beginning. And then I think that Porter was so nice as to put it into the chat, and also the interest form. Thank you, Porter. Awesome. So yeah, that form, it sounds like based on what Sarah has reported is that it's the same no matter which resource that you're grabbing that link from. So just go ahead and fill it out. I have a brief follow-up question, Brian. I think that you kind of spoke to whether employers were going to sign people up or not, and that it was kind of like a case-by-case basis based on where you work. But I know that some people had questions, or maybe they had heard from somewhere that doctors were making a list of people that they felt needed to be prioritized. And so I think that there's a few people who are confused about whether they need to sign up themselves or not, or if their doctor has. Would somebody mind providing some clarity?
I can take that one. So as of right now, with the limited number of doses and limited vaccination sites, physician offices are not signing their patients up currently. There are a lot of practices within Douglas County that have registered to be a vaccination site, and they will go online as we start to see an increase in vaccinations arrive into Douglas County. But at this point, if you qualify under phase 2 at 65 and older, you will need to opt in on the form. The physician practice will not be making that phone call for you. We have identified a kind of a pattern where we know people may not have access. So we are putting a percentage aside of each of our doses. So I know there's been questions come up that, you know, the schedule comes online and it's a race to get onto the schedule, and I'm not as fast as my neighbor next door. You know, I want to be in line just as much as they do. So we learned a lot from that first go round and improved it for the second go rounds, where the opt-in list for the cohort that we did at the hospital went out to 1,300. I think we did learn from that, and I believe it actually made the newspaper, that we learned that friends were sharing the link to friends, and it ended up taking more doses than we were going to allot for that round. So out of the 1,300 we sent out, we had around 300 or 400 friends share with friends, and so it inundated the schedule. So we're learning as we go, we're adapting as we go. Those 1,300 that were selected in that phase will get their vaccination. We're actively working right now to make those phone calls over the next couple days. So be patient. With the allotment that we're setting off to the side, those are designated from an equity standpoint for those that may not have quick access to the internet, may not have the ability to call themselves. They rely on friends or family to do those types of tasks for them. So we're allowing a little slower model to where 10% every day is for that subgroup. We highly anticipate increasing that percentage as we start to see an increase in doses. The state is closely monitoring how many doses they distribute to Kansas compared to how many doses we vaccinate out. So we want to try to get an allotment in and try to get it out as quick as we can, so the state sees that we're moving quickly and plan to get more doses in. So we definitely learn as we go. We make mistakes as we go. You know, we are in a pandemic, and something that definitely for me, I've not had to weather the storm of. So we're definitely taking the feedback from the community and making improvements as we go. And you'll see that as we continue on.
Thank you so much, Brian, for providing the clarity around that, because I think that would have that those kinds of questions would lead people maybe not to sign up when they should. So thanks for clarifying that. I'm going to bounce the next question over to Dr. Scrimshire. So somebody asks, are vaccinated individuals still expected to adhere to public health guidance like social distancing?
Absolutely. There's going to be not really much changes. The only change that we know about right now is that you won't have to quarantine if you've received both doses of the vaccine, of either vaccine. I have changed how I explained it because I think it was coming out wrong and people were confused about the duration of protection, but or whether or not it offered protection. But if you think about any other bacteria or virus that you get, it comes into your body, and then there's a period of time it takes to replicate to an amount that either causes problems, causes symptoms, or can be spread to other people. So, you know, the virus comes into your body, and at the same time, your immune system's like, hey, what's that over there? But it takes a minute for the immune system to catch up to the virus. So it's essentially a race between how fast the virus replicates and how fast your immune system reacts. So there may be a period of time where, despite having gotten the vaccine, you may be infectious to others.
Thanks, Jen, for giving clarification to that question. I know that's a really frequent question that we received from the community. Next question, I'm bouncing it over to Rua Hasabala. Is there free COVID-19 testing in Lawrence?
Thank you, Alex. And hello, everyone. That's a great question. There is definitely free testing in Lawrence. I do have an update, and you'll be able to see a press release about it tomorrow. But we're really excited that Douglas County is going to start having a well health site that's just going to be a standing site in our community. And it's going to be located at Walmart on Iowa Street here in Lawrence. And it's going to be available Mondays through Saturdays from 9 a.m. to 5:30 p.m. And so that will be open anytime someone needs a test. It will be available. There is a drive-through option, but also a walk-up option for those who might be in need of transportation. They took the bus, and so you can walk up as well. You will be able to get some information about where to sign up. So there is the website gogettested.com where someone can sign up, but you can also walk up to the site. So we're really happy that Douglas County now will have that location. We know that our neighboring counties have had a well health site, and so that will be available for our community. We're also partnering with organizations like Sanctuary Alliance, Lawrence Mutual Aid Network, Sunrise Project to reach our community. And so as part of that, it's also looking at how can we translate the material that we have into different languages. We have some supports from KU, so that is moving forward. And we're just glad to have that opportunity for people to get tested. We also invited the Chief Judge, Jim McCabria, to our surveillance testing meeting to support with resuming jury trials and providing testing. Because as we think about equity, I think about criminal justice and providing that speedy trial. And so that is something in the works where we're supporting the being able to resume jury trials. So that's where you can get free testing. I will be able to share our website for Lawrence Douglas County Public Health, where it lists testing resources. That will be updated now that we have confirmed as of today that new site that will begin, and that will start on Tuesday of next week. So if you need a test 9 to 5:30, it'll be available Mondays through Saturdays.
Thank you so much, Rura. Next question is, Douglas County is home to 3 universities. Where does higher education fit into the vaccine prioritization phases, and why? I'm going to kick that over to Brian.
So right now we're following the state provided plan. Within phase 2, we're doing the education sector. It's identified currently as K through 12 in phase 2. There has not been identified phase in which the higher education sector falls into. So we actively monitor if there's any change in plans that come down from the state, but currently they are not in phase 2, but we'll definitely keep an eye on that. And there are definitely questions circling of when and where they will fall within the phases.
Sarah, do you have anything to add?
Yeah, the only thing I would add is if you're affiliated with the university and you're over age 65, well, then you qualify as an individual over age 65. So you should go ahead and complete the vaccination form and go that route. If you're affiliated with the university and you work in food service, which is a prioritized group inside phase 2, you should go ahead and complete the online vaccination interest form and indicate that you work in food service. So that's our advice right now until the state, based off of what the state guidance has told us in terms of how we serve universities.
Thank you so much, Sarah. So it sounds like people should file themselves under different phase priority groups if there isn't at this time a higher ed one. Awesome. Sounds like I got it. Okay. Next question is, and this is going to be to Dr. Scrimshire, is are there medical conditions or medications that disqualify someone or should be discouraged for someone from being vaccinated?
As far as medical conditions, I'll talk about allergies separately, but no specific medical conditions. The Moderna can be used in 16 and older, Pfizer in 18 and older. The caution comes into whether or not you've had a reaction to a previous medication. So oral medications, foods, dander, family allergies, those are not considered, those are not concerning. But if you've had a severe reaction to an injectable medication, so an IV medication or another vaccine, then what we'll do is a risk assessment when we discuss with you, or you can discuss with your physician and determine whether or not your type of allergy will keep you out or we're allowed to vaccinate you. If we do vaccinate you, you've had a reaction in the past, we'll just watch you for 30 minutes and then let you go about your way. And then for the second dose, if you had a anaphylactic reaction to the first dose, then you should not get the second dose. And by that, I mean immediate type reactions. They usually occur within minutes, but I think the definition's within 4 hours. But this is lip swelling, mouth itching, throat swelling, trouble breathing.
Thanks, Jen. So just to clarify, I'm not sure if maybe you misspoke for a moment, but Pfizer I thought was 16 and up and Moderna is 18 and up? Or did I have those switched?
I can look. That's what I had in my head.
Okay.
Give me a second.
No, just making sure, as people listen back to the recording, making sure that people are directed to the right option. So just interrupt me whenever you have that information. Next question is, and I'm going to bounce this to probably Tiffany or Brian or Sarah. Within each vaccine prioritization phase, is there sub-prioritization? In other words, priorities within the priority?
So I'll start it off. So I know another kind of a sub-question come up from my previous discussion. What does a subgroup consist of? So within the phases, there are, in phase 2, 3 groups, and then each phase has an additional group that basically states, pick up whatever you didn't do in the previous phase. So as we're in phase 2 now, we're still actively picking up the trickling effect of phase 1, and then when we're completely done with phase 1, we'll go phase 2, and then when phase 3 opens up, we'll do both phase 2 and 3. So within phase 2, you have 65 and older, you have congregate settings and high contact critical workers. So within each of those, there are groups. So for example, in the high contact critical workers, there are firefighters, police officers, first responders, grocery store workers, K through 12, childcare and daycare, food processing, aviation manufacturing plants. So there's groups within those. So the way we have devised it right now is taking an estimate of what our population represents. And when doses arrive, we split those amongst those different entities to try to equitably distribute doses across each of those subgroups. Those subgroups have been broken into 5 different parts. And I don't know, Sarah, if you want to speak more directly to those 5 different groups within the distribution plan for phase 2 in the county.
I'd be glad to. Inside phase 2, at Unified Command, we felt it was very important that, and it's important to stress, everybody deserves this vaccine that wants it. Everybody needs this. This is something that's a critical need for our whole community. So we're working our best to make sure everybody in those groups receives vaccine. So it has been somewhat distributed based off of the number of people that might be in a particular subgroup. And then if that particular subgroup, everybody who wants vaccine has it, we might pivot and shift vaccine to make those things work. But there is no prioritization necessarily inside phase 2 of one of those groups over another, because we all acknowledge that all of those groups are important and we need to do our best to try to get that out. Please understand, again, as we've said all along, we have such limited supply of vaccine at this point. I don't know that we've said these numbers earlier, so I'll say them now because I think they bear repeating. We estimate that roughly 40,000 people in Douglas County fall into phase 2. We're currently receiving less than 1,000 doses a week. So I know most of you can do the math on that as to how long it's going to take to move through this phase. Now, I have every hope and assurance that the amount of vaccine will increase soon. And I'm really excited about that. And I think it's is something we all desperately need. But at this point in time, it's going to be slow. And it's not because we're putting one group over another. It's because the amount coming to us is so slow. So we're going to be working to try to distribute vaccine to all of those groups as it becomes available to us. Does that Does that kind of get what I think everybody's asking about?
Yeah, Sarah, that's an alignment with a lot of the questions from our online forum. People wanted to know, was there any kind of rhyme or order within the phases? Was there sub-prioritization that people didn't know about? And who's making those decisions? So thanks for clarifying.
Yeah, and I would add in there too, Alex, I think there was also some confusion when the state shifted their plan. Originally, they had phase 1A, phase 1B. And within that, they were doing 65 and older and trying to sub-prioritize based on the health of the participant. That shifted when the state changed their plan in the first part of January. So it is now just a group of 65 plus. It is not based on health risk or any type of stratification to prioritize.
Thank you, Brian. That's another key element is that things are changing and these decisions are happening above us and we are having to adjust accordingly. So thank you so much for shedding light on that. We are getting pretty close to the end of our scheduled pre-selected questions that we had from the online form portion. So this will be kind of like lightning round, 2 questions. So first question, the vaccine comes 10 doses to a vial or bottle, meaning that we need even numbers of people or else we risk throwing some away. What's the plan to reduce wasted vaccine? And that can be, I'll put it to Tiffany.
So I think collectively we've all grouped appointments together. If you're doing Moderna, groups of 10. If you're doing Pfizer, groups of 5 to 6, because most of the vials you can pull 6 doses off of it. We have not dispersed the Pfizer, so I would let Brian lead that question. But as for Moderna, we're grouping them in groups of 10. Your first dose, you're coming in groups of 10 so that we ensure we don't waste that vial.
Thanks, Tiffany. Speaking of which, Dr. Scrimshaw, did we get any headway on the Pfizer versus Moderna question?
Yeah, I was just typing it out for you. But so I had just gotten through reviewing the studies, the studies that are enrolling, because there are studies for younger age groups and for the vaccines. But you're right, Pfizer's 16 and up.
Okay, thank you.
So thank you. Keep me honest, everybody, always.
Yeah, and I wanted to add on to Tiffany as well. So both the Health Department, LMH, and Heartland is working collaboratively together. So we're keeping lists of people at the end of our day. So if someone does show up, for example, if you had a couple no-shows and the last person shows up, causes you to open the last vial or one more vial of whether it's Pfizer or Moderna, you may end up with 4 extra doses or 9 extra doses. So all 3 groups were coordinating with one another and we would make phone calls at the end of the evening. So Heartland would call LMH and say, hey, we've got 4 extra doses. Can you send people over? So we had a call list and we would let those people know, hey, please hop in your car and head over to Heartland. The health department was doing the same thing if they ended with doses at the end of the day. Then LMH would do the same thing if we had doses left over. So I believe at this point in time that we have had 0 wasted doses outside of either having issues with the vial or with needles or equipment. But outside of having doses left over, we have found qualified patients that actually receive those doses. So I think it's been a really good collaborative group effort across the community to make sure that they're going in deltoids and not in trash cans.
Thanks, Brian, and thanks, Tiffany, and thanks, Dr. Scrimshaw, for the clarification on the differences between the 2 vaccines. I know that people are very curious as to what those are. So thank you for wrapping that up. Last question of the pre-selected questions that we have for tonight, and I'm going to pop this over to Tiffany again. What do people need to bring to their vaccine appointments? People were curious about, do they need to bring insurance cards, driver's licenses, things like that?
Definitely a photo ID. Definitely your insurance card. And that's pretty much it. I don't know if Brian, you guys require something different, but pretty much just as long as you have something to identify yourself. So that can be a driver's license and or passport and your insurance card.
The only thing I would add is the drive-through vaccination clinics, we'd like you to wear a short sleeve shirt.
That makes sense.
And have patience, because each of the entities, you have to wait 15 minutes post-vaccination for observation. Just in preparation, if you do have a reaction, we have equipment at each of the locations that are given vaccinations to treat you rapidly. So just know that, once you get through the process, which probably averages around 5-10 minutes, you have another 15-minute observation. So make sure you're prepared for that.
Also, Alex, we want to know that if you don't have insurance, you will not be turned away. So please, if you don't have insurance, please still show up, get your vaccine. You will not be turned away. Make sure you just have a picture ID so that we can have your information in the system.
Thanks, Tiffany. Very important point. Awesome. Well, that wraps up the panel discussion of pre-selected questions that we received on the online form that Rua was so nice to put together for us. Thank you, Rua. We know that we won't get through everyone's questions tonight, and so we thank you for tuning in and for being respectful if we don't get to your specific question. Porter did let me know, again, he's the moderator. Porter let me know that through the registration process for this evening that your email addresses were collected, obviously as a point of signing up. And so if we noticed that there was a question that you posed that we did not get to, we may actually do some direct following up with people. We're also using all of these questions as input for updating FAQ sheets that different institutions are putting together. And so no matter what, your questions have come in handy, and we appreciate them. And we are so thankful that you're looking to credible leadership instead of social media friends and family. So thanks for trying to ask people your questions. And so we appreciate that. We are going to begin the what we're calling the live Q&A. We are doing it in a chat moderated fashion. You should chat your questions in the chat function to, so Porter, do we want them to go to you or to Carrie Britt? We got two options.
They'll be sending the chat to me and Carrie at the same time if they send a chat.
Okay, great. So send those questions to Carrie and Porter, and just to give folks a chance to start typing in their questions, and for the questions to get forwarded to me to ask the panelists tonight. I'm going to go ahead and go over those resources again that we shared at the beginning of our session. So again, we have the coronavirus Response and Recovery Hub. This is where we're going to be putting daily stats and announcements that you may be interested in. There's also the City of Lawrence's page. There's LMH Health's page. And just a reminder that they have a call line for scheduling questions. That phone number is 785-505-2424. And I'll repeat that. It's 785-505-2424. And that's for scheduling questions for LMH Health. And then as we've been talking about tonight, we also are in partnership with the Senior Resource Center. They're helping to provide accommodation for people who maybe struggle with using devices, or maybe they have issues of access to internet or access to devices at all. And so they're specialized in helping older adults who are prioritized in phase 2 at this moment. They're specialized in helping older adults navigate those issues of access and making sure that you can sign up on the vaccine interest form. And then lastly, we have the health department page, which of course is updated very frequently with coronavirus information. Alrighty. So do we have any questions coming in yet? I'm checking my email from Porter and Carrie. If not, I can continue reading the questions of pre-selected questions as well, which are also questions that folks submitted.
Sorry, Alex, I was having trouble getting back to the screen. We do have questions, and I am going to email them to you now. We had a little tech glitch, apparently, and so I thought Carrie was seeing the questions, but bear with me 1 second, and they're coming.
No, not a problem. I'm actually going to go ahead and pose another question from our pre-selected list, because there's a lot of really great questions on here. Let's see. Okay, this is a good one. Is there any way for someone to know which vaccine, Moderna or Pfizer, will be administered at their appointment? And I'll put this to Tiffany.
Yes, it just depends on where you're going. If they ask, we'll know which vaccine we're going to give them, so we're more than happy to tell them. In some cases, it could be either or, depending on where you go. I know with the agreement that we all have in place, the health department, LMH, as well as Heartland, we will be distributing both vaccines. So all they would need to do is ask us.
Thanks, Tiffany. Let's see. This is another really good question. So somebody was asking a little bit more about vaccine scheduling and if they would be able to schedule multiple members of their household at the same time for convenience. And I'll put this over to Brian.
Yeah, I'll take this one. So when we, what we learned from our last round of scheduling 1300, we realized our randomizer did not group households together. And we definitely had people coming in. They may have a difficulty transporting in, and we'd like to get them done at one time versus making them drive in multiple days. So that question has been posed back. Is there a way for us to group households together within the randomizer, or do we look at the percent of people that are coming in as a family and look at maybe just reserving a percent, knowing that we'll need to vaccinate both husband and wife at the same time? So don't have a direct answer now how to really handle that in an equitable way, but definitely something we're looking at and trying to find a way to make that occur.
Thanks, Brian. Does anybody else on the panel have anything to add to that? All righty. Well, I did get the message from Porter, a compilation of all of the questions from the chat that we've received. I imagine, Porter, that you'll continue sending me questions once you get enough to send another shipment over to me. So I'm looking at them. So one person asks if they can go to their doctor's office for the shot. It sounds like that they're over 65, and they were curious if smaller doctor's offices were going to be providing shots.
As of right now, there are only 4 entities in the county that are providing the shot. That will be Lawrence Memorial Hospital, Lawrence Douglas County Public Health, Heartland Community Health Center, and Haskell.
Thanks, Tiffany. And I think it would be important also tonight, since we've talked about it a couple of times, why don't we go ahead and clarify what's happening at the Indian Health Service, because I think people are curious. They're at different phase than the rest of the county. So I don't know if you or Brian would like to talk about that.
So they did, you want to take that, Tiffany, or I can? It doesn't matter.
You can, it's up, you can. That's fine.
Okay. So they have received their doses to vaccinate their health department within Haskell, but they also have the responsibility and guidance from the state to go out to other Indian nations and give those vaccination doses out that are outside of Douglas County, and that is the group that they're currently working on. I would also add to the question of, can I go to my doctor's office to get my dose? One of the reasons that's real difficult now is because, one, we don't have a lot of vaccinations, and two, it's difficult to distribute all the doses out of a single vial if you do a bunch of one-off vaccinations. So once you open up a vial, you have a roughly 4-hour time period to give all those doses out. And if that office is not equipped or have that many patients that qualify in that 4-hour time frame, then those doses will get wasted. So until it's a more coordinated effort out within the clinics, that's why it's under a centralized program right now.
Thanks so much, Brian. Next question is the booster dose the same as the first dose of the vaccine? Let's see, maybe Tiffany.
Yes, it is.
Awesome. And is that the same for both of the vaccines, Pfizer and Moderna? They're both the same?
Yes, and I'm following Dr. Socher's head shake.
Yeah, they're the same, and you can't mix. You can't get Pfizer for your first dose and Moderna for your second.
Yeah, very important point. I think it goes back to the importance of trying to get both doses at the same provider. It just makes things a little bit simpler because they'll know which brand that you got vaccinated with the first time. So,
and kind of gives people a glimpse into the difficulties, how hard this is to schedule. So you have 2 different vaccines in 2 different periods, so 21 days versus 28 days. And it's not an easy task.
Awesome.
Alex, if I I just wanted to add a little bit about the conversation about Haskell. I think it's important just from a big picture perspective for folks to understand. And because this is true also, we're really close to a Veterans Administration hospital, even though they're not located in Douglas County, but we have a lot of veterans who live in Douglas County. Often, if anybody has an association with those federal groups, like the Bureau of Indian Affairs through Haskell Indian Health Services and the Veterans Administration, those groups are often receiving their own amount of vaccine and have a charge to distribute it to the folks they serve. So you may hear about like, oh, I work for the VA or I'm a veteran and I got my dose. Well, that's because it is coming through different pipelines. Not all of it comes through the county. We don't actually always have a complete pulse on that. And it really is decided by the federal government moving through the state and through other federal agencies. So there's a lot of different folks involved in this process and distributing vaccine to our community. And we know it can be confusing, but it's the best way to get it out to the most people in the fastest manner.
Thank you, Sarah, for clarifying that, because I think that that's really important as people are hearing, oh, well, somebody I know got their dose and, wondering about where they fall and why they may be receiving their dose at a different timeline. I think that that's all really important. So thank you. Next question is, there are many people in our community who have fallen victim to misinformation, such as that the vaccine will contain a microchip, could kill you, or is against, let's see, I'm trying to kind of read all this. Basically that there's misinformation and myths being perpetuated, and they want to know if the county is doing anything to counteract that misinformation.
I'm sure there's some more specific questions, and I'm sure Dr. Scrimshire would like to talk about how these vaccine myths are so frustrating for folks that have worked so hard to help keep our community safe. But really, we put out a lot of really great information on that Douglas County Hub website talking about the safety of these vaccines and trying to promote that. So, I think please, one of the things I would suggest that we've learned in this process is, if you're having a phone call with a neighbor and chatting about this information, please share this information. Please share these resources about where you can get solid, good, helpful, accurate information about vaccines, and refer to them to our website so that we can help make sure that that correct information gets out to the community.
Thank you. Another question that we received is, on tonight's national news, Kansas was listed as one of 12 states that have administered only half of the doses that they've received. Why is that?
I can answer that one a little bit. I was on a call with KDHE today, and it's not that we have not administered the vaccines. What we're noticing and what the state is noticing is on our end, so on the hospital's end, on Heartland's end, on the health department's end, we send in the information. Somewhere in cyberspace, the information does not cross over. So what they have done, it looks successful. It may look successful on my end. It may look successful on Brian's end, but the state has not received it. So what Dr. Norman and Phil said today on the call is that they're going back and they're working with their IT department to make sure that they have accurate data, because they do not believe that that is a true representation of the numbers of people that we're vaccinating on a daily basis in this state. I don't know if Brian wants to add anything else.
Yeah, I believe they sent out a letter as well stating that they've hired a third-party BCG to assist with the logistics of the data. So it should start seeing that get cleaned up.
Thanks a lot for answering to that question. Another question that we're getting is, how long does the vaccine last? I don't know if maybe Dr. Scrimshire wants to address that one.
Well, I can't tell you because there's not a long enough period to say yet, as far as the trials go. Moderna came out with a statement not too long ago that they think theirs is going to last at least a year. I've seen data for Pfizer out past, right at 4 months. I think the last longer period then with natural infection for the most part, but I can't tell you for sure just yet. I'm waiting for my crystal ball, Brian. Can I order one of those from you?
I've got a magic
that'll
8
work.
ball. We can maybe pick it up and see.
Thank you for answering all of my panelists here tonight. Thank you for answering these questions on the spot. I know that this is, some of these questions we may not have answers to yet. And I think that that's something that the community members also want to know. So thanks for sharing that. So let's see. Next question. When you get vaccinated, will you get proof that you have been vaccinated?
So when you do receive a vaccination card, they write on that for your first dose. And when you go back, they write on that vaccination card for the second dose, so you can keep that for your records.
And if you lose your card, you can always call the place where you got vaccinated, and they will be able to provide you with the additional record that you were vaccinated.
And since all of this has to be uploaded into the state system, it's the vaccination tracking system. If your physician's office has access to that, it should show up there as well.
Thanks. So we just have time for one last question because we still have to do some closing remarks and announcements and housekeeping. So last question, will the parents of children with severe medical risks be prioritized?
I think it's important. I'll step in here, and obviously if Brian or Tiffany have other things to add, that would be great. We are really governed by what the state puts forward in terms of the prioritization and who we can give vaccine to. So those phases are outlined. I think Alex showed a reference to those prioritized phases, and that is really not. We don't have a lot of flexibility here at the local level to change that. Actually, hardly any. So we are not in a position at this point to change any of those prioritizations. So unless that parent of a child qualified in some other part of a phase through their employer, through other things such as that, or if they were a caregiver and qualified under health care, we don't have the ability to alter that those prioritized phases that come from the state.
Hey, Brian or Tiffany, so at one point during one of the health department calls, the TDHE health department calls, they had said that for those people, if there's a family member that was providing health care to someone in the home, that they were eligible.
Yeah, that is correct. They're working on a way to identify that and actually quantify that information from that individual. But if they do have a means to provide that, they are a caregiver for a family member in the home, they would qualify under phase 2.
Well, thanks, everyone. Thank you for answering a lot of these questions. I know that tonight's panel ended up centering quite a bit on vaccines and some of the accessibility issues with getting signed up for getting vaccinated and for notifications about vaccine information. Certainly a little bit about testing, a little bit about equity. It sounds like another event like this would be very good to have. And we've begun a little bit of discussion about potentially holding another panel, potentially with different panelists in the near future, so we can continue getting through these questions and maybe expand a little bit more with testing and equity. And I think that we've touched a little bit on those things, but it would be great to really dive in. So thank you so much to my panelists tonight. I know that you're all working overtime and we have a full day tomorrow. And a lot of you probably work through the weekend. I know I am a little bit at the health department getting some of this planning done. And so I really appreciate you making time tonight to help provide clarity to our community members and provide information and to engage with their questions directly. I think a lot of people have a lot of questions. And again, we're not able to get through at all. We put a dent in the questions, but there are many, many more questions, really great questions. Thank you everyone for, you all word your questions so good, so concisely. Everything was really easy to read and I appreciate that. We have a log of those questions. And if you registered and your email address was included with that, we can follow up with you on your questions and definitely keep your eye out for our FAQs and our website and resources that we shared, because your questions that you posed to us, whether it was through the online form or through the chat tonight, or it was one of the questions that we did get to ask, all of that's going to inform our planning and our FAQ sheets. And so all of it was very worthwhile. And so we really appreciate you. A couple of extra thank yous to my panelists, Brad, Tiffany, Rued, Dr. Scrimshire, and Sarah Plinsky for stepping in at the last minute. Sonia George was was originally in her spot. And so we appreciate you with basically, I think, was it 45 minutes notice or something? Impressive. So thanks for stepping in. A huge thank you to my chat moderators, Elizabeth Stevens, Carrie Britt, and then my co-moderator, Porter Arneal, who was doing some chat moderation, as well as a bunch of other technological things that are very difficult to do. I thank you so much, Porter. I'm thinking if there's anybody else to thank. Community members, thank you for coming and sharing your questions with us. This is a very, very stressful time, one of the more stressful times in a lot of our lifetimes. And we just appreciate you taking the time to come get informed and at the time ahead of time to get registered, to submit your questions if you did so. And we appreciate you continuing to stay informed. We really appreciate and appreciate your trust that you've put into us as public health entities and leaders. So before I take off for the night, I don't know if anybody from the planning team has any extra announcements, maybe news that just came in that we need to share at tonight's meeting, maybe from Porter, Robert, Sarah. No pressing news?
I just want
Okay.
to say thank you, Alex, for being a great host and for, moderating this. It's been great to be able to work together with you on this.
Thank you. I was a little nervous at first, but it broke in. So thank you everyone for being so nice and great audience tonight.
Alex, I just want to add that, these are really hard, unprecedented times for all of us, and that we as a community need each other more now than ever. And that if we could just, show that grace to one another as we navigate this pandemic world. We're going to try to get information out to you as soon as we can. But just know we're trying to be here for each other and get through this, because what was decisions that were made yesterday have changed today. So this team is constantly pivoting. I think we've all been on a merry-go-round for the last 48 hours. So just remember that our community is only as strong as we are together.
Those are great closing words, Tiffany. Thank you so much again to my panelists, co-moderators, supporters, and co-event planners. All right. See ya.
I'm the only one I can't now hear.
Okay, well, it's over.